appreciate them joining us this morning. I'm going to read the remarks here, and then we're going to have some time for Q&A, and Representative Martinez-Fisher will have a few words as well. So good morning, and thank you all for being here today. 10 years ago this week, I filed legislation in the Texas House to address a problem that was brought to me by a constituent back home, surprise medical bills. When I was running for office, I simply asked, what are some of the issues? And this was an issue that came forward. His story, like the stories of some people joining us here today, who I'll introduce in just a minute, was one that's way too common. After having a medical procedure at a hospital that was in his health insurance network, he received a shocking, huge balance bill. Confused and frustrated, on top of being in a tough position dealing with stressful health issues, he asked me what could be done about it. So I decided to ask the folks here. The result was House Bill 2256 from the 81st Legislature, a bill that established the very first mediation process for the Texas patients who received surprise balance bills. For the first time, patients in this terrible situation had some sort of recourse. After receiving a surprise bill, they could contact the Texas Department of Insurance for help for fighting it. The truth is that original piece of legislation faced significant opposition, and it never would have passed if it hadn't been for strong bipartisan support. And that's why I'm particularly honored to have Trey Martinez-Fisher with me today. The reality is they actually came to him and said, can you help us kill this bill? And rather than killing it, he came to me and said, hey, can we work together? Something you don't hear enough at the federal level. Fast forward to 10 years, and here's the situation we're facing today. I'll start with the good news. The mediation works. When it's available and used, we can confidently say that surprise bill mediation has saved Texas patients well over $30 million in out-of-pocket health care expenses. We also successfully expanded the original mediation program in the 2015 and 2017 legislative sessions, adding additional layers of consumer protections. Still, thousands of Texans receive unexpected and frankly unreasonable surprise medical bills every year. Enough is enough. Today, Chairman Martinez-Fisher and I are announcing a landmark legislation on surprise billing that takes the burden off of patients, takes it off of their plates completely. Today, Chairman Martinez and I are moving forward. TDI mediation will continue, but without patients being put in the middle. The fact is that market negotiators in these situations are the providers or facilities and their health plans. The legislation acknowledges that fact. It allows providers to trigger mediation when they have a payment dispute with a health insurance company, while at the same time, and this is key, prohibiting them from balance billing patients. Like the current mediation system, this is designed to apply in situations where patients don't have any choice which facility they go to or which physician's involved in their care. In other words, we're talking about non-network facility-based providers at in-network hospitals, non-network emergency care providers, and non-network facilities in emergency situations. It's important to note that the legislation maintains the patient's responsibility for their copay, coinsurance, and deductible amounts, out-of-pocket costs that were expected based on the health plans they chose. The final bill provision that I want to point out is that we call the ERISA opt-ins. This allows federally regulated, self-funded health benefit plans to opt in to a strong state protection afforded under the bill. These plans make up at least 40% of the Texas health insurance market, and it's our hope that by including these plans in mediation, Texas will send a loud and clear signal to D.C. that similar consumer protections need to be passed at the federal level. Until then, Texas, Trey and myself are committed to doing something about it. I'll pause there to introduce a few people joining us today, and I appreciate them joining us today. Steve and Karen Fairby from here in Austin. Steve went into the ER for stitches when he got a serious cut on his leg. He chose an in-network hospital and gave the ER his insurance ID card. When he got there to confirm that his care would be in-network, he was assured it would be, but ended up being treated by an out-of-network physician who billed more than $1,000 for providing 4 stitches. Steve's insurer said allowed amount for the service was $130. He later received a surprise medical bill from the doctor for more than $900, along with a separate in-network bill from the hospital. He tried to remedy the situation himself by placing a bunch of calls to the insurance company and doctor's billing office to resolve the out-of-network dispute. No luck. He eventually filed a complaint last month with TDI. Drew Calver is also from here in Austin. He's a high school teacher. Drew was rushed to the nearest hospital, ER, after a serious heart attack and ended up having to stay in the hospital for 4 days. The hospital was out of network and sent him a bill for nearly $110,000. A hefty amount on a teacher's salary, I would imagine. In Drew's case, his federally regulated ERISA health plan wasn't eligible for state mediation. Thankfully, media attention helped resolve the dispute, but he never should have been faced with. Both Drew and Steve are glad to stick around and share more about their stories with you one-on-one. We appreciate them very much being here today. In the meantime, I'll go ahead and turn it over to my good friend, Trey Martinez-Fisher, for his remarks to start, and then we'll have some questions.
Thank you, Senator Hancock. Well, Senator Hancock knows how to keep me very brief. He schedules this news conference after a 14-hour Ways and Means committee hearing, so I'm all talked out. But listen, insurance, Senator Hancock was on the committee, and he had an idea that I didn't really understand. And he is right that folks that were opposed to his idea would rather me step in and eliminate the idea because that's what Democrats and Republicans are supposed to do. But as I understood his problem, I put my legal training hat on and understood that if we provided a mechanism, an alternative dispute resolution process, that we can give people an avenue to negotiate these out-of-network surprise bills. And lo and behold, it works. And I will tell you, fast forward 10 years, within a couple of weeks of winning a Democratic primary in 2018, I sent Senator Hancock a news link by text on a balance bill issue and said, I want to work on this when I get to Austin. And here we are. I didn't know that finally we connected and we realized that it's best that we can work together. He knows the problem very well. I understand how to come up with a solution that takes patients. Insurance companies have a responsibility. And so why should a patient get caught up in the middle? And here's how I see it. I'll be real frank and very blunt. It has been an industry issue for a few years, I grant you that. The health plans and the providers fighting over, their business interests, and I respect that. But 10 years later, it's now becoming a consumer issue. To their first party, which is their healthcare provider, and they have third party rights to somebody that they go in and do business with. This affects credit ratings, there are billing practices, there are, in my view, some misleading and deceptive language in these contracts and these authorizations that when you're in a gurney, you're not going to take the time to read. And so this is now a consumer protection issue. Now we'll be looking at this through the lens as consumers who are paying for a service and are paying for coverage, and lo and behold are beginning to find out that that coverage doesn't go as far as they thought it would go. And so last night and this morning, as I received some calls from folks very interested in this subject matter as a stakeholder and said, hey, we had no idea you were working on this. I said, how do you think it feels like to be a patient? If you think it's a surprise that I'm working on this, how surprised are they when they receive a bill for an excessive amount of money that really isn't of their own free will and choosing? So look, we're all going to get together, we're going to work on this, but we're going to put the patient's interest first. We're going to use our experience in working with this in a bipartisan fashion, which is really sort of refreshing around here. And we're going to hope to get something done. And so that's my commitment on the House side. And those of you that have something to say about it, have an opinion, you know where my door is and you know where I sit. I'm happy to visit with you. So, Senator Hancock, thank you. And I'm sorry that you had to experience this, but hopefully we can provide some measure of relief for you in the future and for those in your community.
We'll take a few questions if you have some. If you want to address them, my guess is would you prefer that be offline? So they'll be glad to talk later on one-on-one if you would like.
To go into a mediation process pretty much automatically, right? But what is the guarantee that they don't get the short end of the stick if two providers, a medical provider and an insurance company say, oh.
Well, I mean, really the agreement is between those two providers. I mean, the one that provided the service, the one that provided the insurance on it. And what we've found in the mediation process is the vast majority of the time, it's really just a simple phone call once this starts. Now, it doesn't automatically get kicked in there. Somebody has to initiate this, but what it does is it doesn't require the patient to initiate the mediation process. And bottom line, this has just been very, very successful. And in fact, the portion that Trey wrote took us down. I mean, we tracked this all the way to courts, right? But we really haven't had to see that. Most of the time, this has worked out early on where the patient's not involved in the mediation.
In the case of Steve, let's say, can you kind of walk us through how that would work under your legislation?
Right, and because ERISA plans are treated differently, federally regulated plans, constitutionally, there were some issues there in mandating it. But what we want to do is allow that option for them to enter in. Now, I think we'll have some that will enter in. Self-funded plans and ERISA plans will join into this. It is beneficial. We've seen where it's been beneficial, and hopefully they'll want that for those involved in those plans. Frankly, that'll probably take a little pressure as well. But the other portion of this, which I said in the release, is we're hoping that this actually puts some pressure on the federal level. The mediation that we came up with together has been moved through other states, and it is time to move this to a federal level and fix this problem for patients.
Any idea what percentage of patients we would be able to include in this if your legislation passes? I talked to TDI yesterday, and they were saying, well, right now mediation is only for about.
Right, we do know that for ERISA plans, the federally controlled plans is 40% of the market. So you're looking at a significant increase of patients in there if we can capture somewhere on Medicaid, Medicare on doing that. But it's going to be a significant portion of the market.
And this would be all balance bills or just in emergency situations?
So, and we'll be filing the legislation, or was filed today. You'll be able to read that and see it. What we really are focusing on is where the patients don't have a choice. Where you walk in, and there are those that will say, well, we want the patient to be involved in this decision making and prompt this mediation. Well, the reality is the patients are taking out of the equation when they walk into a facility with exclusive contracts and they have no choice on what doctor they're going to be seeing, no choice over what radiologists or those behind the scenes that they're not selecting. And so that's specifically what we're targeting, is where the patient really has no option from the very beginning. Therefore, why should they now have to be engaged when you didn't give them a choice of what physician they were seeing in the first place?
For those federally funded plans and the self-funded plans, is there going to be an effort to communicate to patients that this is something they have as an option? Because right now, a lot of patients don't know that this is even, the TDI program is even something they have available to them.
Yeah, one of the things we saw is from the time we passed this mediation 10 years ago, there wasn't a lot of involvement in the mediation. So we had a good plan that we came up with, but people didn't know about it. And what we've seen really through y'all's help and through the media and those, Stacy, those that have been involved in the program, promoting the program, more and more people are learning about it. And the reality is the reason we're at $30 million in consumer savings is because the word is getting out there. And so we're hopeful, part of the press conference is getting the word out there so that people know the consumer protections that we're looking at on a bipartisan level to help them deal with this issue so that they can heal and move on.
Is there going to be any kind of increase in TDI staff or resources to deal with potentially more mediation requests coming in?
Well, we've discussed a lot of this. We'll just have to wait and see how much of that mediation takes place. We think, frankly, that because of what we've already seen is most of the issues are resolved between the insurance companies and physicians. It doesn't have to go too high, that it can be resolved with minimal cost. So, one more question.
Where are the doctors?
Oh, yeah, that was my question too.
Where are the doctors? You have the insurance companies represented here, but where are the doctors? Aren't they, I mean, they're medical providers. I mean, were they part of the discussions in this bill?
Well, I will tell that they were the impetus for the last legislation that we filed in 2017. Very much behind it. They were initially opposed to it, but I will tell you, as I've toured during the interim, I've had physicians ask me, why can't we do this for our patients? And so I think you'll have a number of physicians that are looking to help their patients that come to them and say, why did I get this? And maybe it wasn't from them. So I think you'll have a lot of physicians that will be very supportive of this. I don't know where the association is, and again, we're just getting started in the process. Thank you all very much.